This is skill 24, forward gait and turns with axillary crutches for non-weight bearing and partial weight bearing gait. Some general considerations before beginning. For your patients to ambulate with axillary crutches, they will need to decrease weight bearing by adducting their shoulders, depressing their scapula, and extending their elbows in order to keep the crutches in place under their arm and transfer weight through the crutches. There are different gait patterns that can be used with axillary crutches, and the most common is 3-point gait. All of them have the same starting position with the crutches 6 inches in front of the line of the toes and at a 45-degree angle laterally from the toes. In 3-point non-weight bearing gait, the patient can either flex their knee or flex their hip to clear their foot from the ground. All of the gait patterns, you should encourage your patient to do a step-through gait pattern as much as possible to mimic normal gait. The first gait pattern is 3-point non-weight bearing gait. In this gait pattern, the patient will advance the crutches simultaneously and then advance their non-involved limb with a step-through pattern. And it will look something like this. Crutches, step through, crutches, step through. In 3-point partial weight bearing, once again, my right limb is going to be my involved limb. And to advance forward, first the crutches are moved simultaneously forward, then the involved lower extremity, followed by the non-involved lower extremity, putting as much weight as possible through the involved limb and the crutches. It is important to encourage your patient to do a step-through pattern as much as possible because it is most similar to normal gait. Next are 2- and 4-point partial weight bearing gait, which can be utilized when patients are partial weight bearing but need more stability. In 4-point gait, the starting position is the same, and the patient will alternate sides and utilize a step-2 gait pattern in which the tip of their toe matches the crutch line with each step. So 4-point gait looks like the right crutch advance forward, left leg forward, left crutch forward, right leg forward, matching the line of the crutch. Finally, 2-point gait has each leg move with the opposite crutch. This allows the patient to move a little bit quicker while still maintaining low energy expenditure and being stable. Weight should be transferred as tolerated through the involved lower extremity with the remainder transferred through the crutch and the non-involved limb. And it'll look like this. When it comes to turning, which requires pivoting, it should be done on the non-involved lower extremity whenever possible. Weight should be shifted onto the non-involved limb and crutches are moved in the direction of the turn, and then you pivot and you can reposition crutches as needed to complete the turn. To turn back, you simply reverse this process, moving the crutches in the direction of the turn, pivoting, and repeating until the turn is completed. So at this point, we're going to assume Nicole has been screened and properly fitted for her crutches, and she has been instructed on 3-point non-weight bearing gait. Nicole has decided to flex her right knee, so as the therapist, I'm going to be on the right side of Nicole, maintaining contact guard with 2 hands on the gait belt as she ambulates. The therapist's front foot will be facing forward in line with her crutches, and the rear foot will be at a 90-degree angle in line with her involved limb. If the patient requires closer guarding, they can offer additional support by maintaining their hand on their shoulder. Nicole, are you ready?
Yeah.
All right, whenever you're ready, go ahead and move your crutches forward simultaneously.